Good day to everybody. Today we are going to talk about pancreatic cancer. Let's move on. These are the topics of of my of, that will be discussed today. Its introduction, etiology, clinical manifestations, risk factors, complications, diagnostic procedure, treatment and management, and lastly, prognosis. Let's start introduction. Pancreatic cancer happens when cells that aren't normal grow and start to form tumors in the pancreas, a small organ located deep in the belly and your stomach. The pancreas makes juices that help your body digest food. It also makes insulin and other hormones that help you control your sugar. So there are two types of pancreatic cancer. First is exocrine and endocrine. The type of tumor depends on which type of cells are involved. Exocrine cells make digestive juices. Endocrine cells make insulin. So most people with pancreatic cancer have exocrine tumors, which grow faster than endocrine tumors. Treatments are more successful when cancer is found early, but in most cases, pancreatic cancer has already spread by the time it is found. Still, treatment may still help you feel better and it helps some people live longer. Move on. Um, so there are several types of pancreatic cancers, including adenocarcinoma of the pancreas, adenosquamous carcinoma, and squamous cell carcinoma. Adenocarcinoma of the pancreas defined as this is the most common pancreatic cancer which occurs in the lining of the duct, pancreatic duct. Adenosquamous carcinoma. This is a rare pancreatic cancer which it's have this type of cancer contains two types of cells, squamous cells and gland-like cells. It has been associated with more aggressive characteristics when compared to adenocarcinoma in certain things. Squamous cell carcinoma is also a rare pancreatic cancer. It is made up purely of squamous cells which are not typically seen in the pancreas. Pancreatic tumors and neuroendocrine tumors. There are tumors in the pancreas that are called endocrine tumors because they secrete hormones. They may be benign, non-cancerous, or malignant cancers. The neuroendocrine tumors in the pancreas includes gastrinoma, glucagonoma, insulinoma, and the vipoma. Gastrinoma, a tumor in the pancreas or duodenum, it may occur as a part of the hereditary endocrine syndrome. Gastrinoma secrete above average levels of gastrin, a hormone that stimulates the stomach to secrete acids and enzymes, while gastrinoma can cause peptic ulcers. In glucagonoma, a pancreatic tumor that secretes glucagon, a hormone that raises level of glucose in blood, leading to a rash. In insulinoma, a rare pancreatic cancer tumor that secretes insulin, the hormone that lowers the glucose levels in the blood. This is often a genetic condition that runs in the families. The vipoma, a type of endocrine pancreatic cancer that secretes vasoactive intestinal polypeptide, or VIP. This leads to a severe intermittent diarrhea that causes further problems, including potassium loss, So despite the name, there are rare instances where diplomas secrete hormones other than this. These are the stages of pancreatic cancer. Stage 0, the tumor is only the top layer of the pancreatic duct cells and has not invaded deeper. This is usually called the pancreatic cancer in situ. In stage 1A, cancer is only found in the pancreas and is no longer than 2 centimeters across. The cancer has not spread into the lymph nodes or to any distance of the body. In stage 1B, cancer is only found in the pancreas but larger than 2 centimeters across, but the cancer has not yet spread to the lymph nodes or any distant parts of the body. In stage 2A, the cancer has already spread to the other areas in the pancreas, but yet it has still not spread to nearby lymph nodes or to any major blood vessels or to distant sites. In stage 2B, the cancer may or not have spread to the nearby areas, but it has already spread to nearby lymph nodes, but still has not spread to any nearby major blood vessels or nerves or to any distant parts of the body. In stage 3, the cancer has spread to the major blood vessels or nerves and may have spread to nearby lymph nodes, but still not spread to any distant sites. In stage 4, last, the cancer spread to organs further away from the pancreas. This might include the liver, the lining of the abdomen, and the lungs. So this is the other of the cancer stages. These are the simpler systems that determine the best treatment. These are divided into three groups. First one is resectable pancreas cancer. These cancers can be surgically be removed. This includes many cancers that are still confined within the pancreas or have gone just outside of it. Second is locally advanced pancreatic cancer. The cancer is only in the area in the pancreas, but it cannot be allowed to be removed with surgery. Often this because the cancer is growing into the nearby blood vessels, and because the tumors can be removed with surgery, so they are also called the unresectable. Lastly is the metastatic pancreatic cancers. The cancer has spread to the distant parts of the body, so they cannot be moved completely with surgery. So let's discuss about the etiology. The pancreatic cancer occurs when cells in your pancreas develop changes or mutations in the DNA. A cell's DNA contains the instructions that tell a cell what to do. These mutations tell the cells to grow uncontrollably and to continue living after normal cells will die. These accumulating cells can form a tumor. When left untreated, the pancreatic cancer cells can spread to nearby organs and blood vessels and to distant parts of the body. So most pancreatic cancer begins in the cells that line the ducts of the pancreas. This type of cancer is called the pancreatic adenocarcinoma or pancreatic esophageal cancer. So less frequently, cancer form in the hormone-producing cells or the neuroendocrine cells of the pancreas. So these all have this discarded. This is a rare disease. This is a rare pancreatic cancer. This is called the pancreatic neuroendocrine tumors, or islet cell tumors, or pancreatic endocrine cancer. So these are the factors that may have caused you to have a pancreatic cancer. First is one is smoking, diabetes, chronic inflammation of the pancreas, family history of pancreatic cancer, obesity, older age, as most of people are diagnosed after age of 65. The pathogenesis. The pancreatitis starts with initiating factors: the alcohol, smoking, gallstones, drugs, obesity. Well, it changes in the cellular environment and premature digestive enzyme activations. Mutation of genes associated with trypsinogen activation or inactivation predispose the pancreas to development of the disease. As the disease progresses, defective autophagy increase. There will be a defective autophagy, increased inflammation, the pancreatic stellate cell activation, and fibrosis, of course. Advancement toward pancreatic cancer and metastasis is also associated with defective autophagy, as well as extracellular matrix dehydration, subproliferation expression of oncogenic CRAS, and loss of tumor suppressors. So next one is the clinical manifestations. Pain in the belly or back, jaundice, unexpected weight loss, loss of appetite, extreme tiredness, depression, light colored stools, dark colored urine, and itchy skin. This one is the risk factors. Age. Most pancreatic cancer occur in people over the age of 60 or 65. Being male, more men than women are diagnosed with pancreatic cancer. And smoking. Cigarette smokers are 2 or 3 times more likely than smokers to develop pancreatic cancer. Family history. The risk of for developing pancreatic cancer triples if a person's mother, father, sister, or brother had the disease. And it's diabetes and chronic pancreatitis. Let's move on to complications. Pancreatic insufficiency. When tumor takes over the cells, the lack of enzymes and can result in malabsorption, abdominal cramping, and malnutrition even with normal diet. So bile duct obstruction. This is one of the common complication of pancreatic cancer and may be present at the time of diagnosis. Even when surgery is not possible, a stent can be placed via endoscopy, a procedure that involves inserting a tube to the mouth and threading it down and into the common bile duct. The stomach or small intestine obstruction. An obstruction caused by the growing tumor may cause either in the area where the contents of the stomach pass into the small intestine or the first part of the small intestine. If this occur, a stent can be placed to keep these areas open, or instead, surgery can be done to bypass the obstruction. Next one is the diabetes. As noted above, the sudden unexpected onset of diabetes may herald the presence of pancreatic cancer. Next one is cachexia. It is also known as cancer-related anorexia-cachexia syndrome. It is a syndrome that involves weight loss, muscle wasting, and loss of appetite, although it likely begins even before any weight loss, of course. It's thought to be present in up to 80% of people with pancreatic cancer at the time of diagnosis. The blood clots, pain, last is jaundice. The pancreatic cancer blocks the liver bile that causes jaundice. The signs are yellow skin, eyes, dark colored urine, and pale colored stools. Jaundice usually occurs without abdominal pain. Move on to the next topic. So diagnostic procedure, ultrasound, CT scan. CT scan are more detailed than the general X-rays, showing more detailed image of any part of the body, including the bones, muscles, and fats and organs. MRI, endoscopic ultrasound, laparoscopy, endoscopic retrograde cholangio pancreatography, percutaneous transhepatic cholangiography, position emission tomography, pancreas biopsy. So these are the diagnostic procedures. Next one is the treatment and management of the pancreatic cancer. These are the options that will be dependent upon the treatment. It depends on the size and type of the tumor, if it involves a lymph nodes, the degree of metastasis at the time of diagnosis. Next one is these are the part of the treatments, the surgical. First one is Whipple procedure. This procedure involves removal of the head of the pancreas as part of the small intestine, the gallbladder, part of the stomach, and lymph nodes near the head of the pancreas. Most pancreatic tumors occur in the head of the pancreas, so the Whipple procedure is the most commonly performed surgical procedure for pancreatic cancer. Distal pancreatectomy. If the tumor is located in the body, in the tail of the pancreas, it will be removed both of these sections along with the spleen. As one is total pancreatectomy, it will be removed the entire pancreas. Though part of the small intestine and stomach, the common bile duct, the spleen, the gallbladder, sorry, the gallbladder and some lymph nodes, and last one is palliative surgery. It is more advanced cancers. The goal of surgery may be to relieve problems such as bile duct block, or rather than to try cure of the cancer. Next one is the non-surgical treatments of the pancreatic cancer. First one is the chemotherapy. The use of anti-cancer drugs to shrink or kill cancerous cells and reduce cancer spreading to other parts of the body. Next one, external radiation. A treatment that sends precise high levels of radiation directly to the cancer cells. And medications. These are the medications: Abraxane, Afinitor, Arlenatinib, Everolimus, 5-FU, fluorouracil injection, gemcitabine hydrochloride, Gemzar, Enfigim, Irinotecan, Linparza, mitomycin, or my, sorry, rather, mitomycin, olaparib, onivide, paclitaxel, sunitinib, malate, Sotent, and Tarceva. These are the prevention that you may help you reduce the risk of pancreatic cancer if you, well, stop smoking, maintain a healthy weight, choose a healthy diet. Well, if you smoke, try to stop or talk to your doctor about strategies to help you stop, including support groups, medication, and nicotine replacement therapy. But if you don't smoke, don't start. Next one is maintain a healthy weight. If you are a healthy weight, work to maintain it. If you need to weight, if you need to lose weight, aim for a slow, steady weight loss, 1 to 2 pounds a week. Combined daily exercise with a diet rich in vegetables, fruit, and whole grains with small portions to help you lose weight. Choose a healthy diet. A diet of full, colorful fruits and vegetables and whole grains may help reduce your risk of cancer. As one is the prognosis. A pancreatic cancer outlook depends on a great deal on the cancer stage at the time of diagnosis. Advanced of pancreatic cancer are generally more fatal than stages due to the disease having spread Well, if the 5-year relative survival rate for a specific stage of pancreatic cancer is 50%, it means that people who have that cancer are, on an average, about 50% as likely as people who would have cancer to live for at least 5 years after being diagnosed. So that's it for the pancreatic cancer, and thank you guys for listening today, and I hope you learned something.